You can do this. I can do.
Hello, everyone. Good evening. It's Thursday again. So we have our Facebook Live on Next Generation NCLEX. So welcome to our program tonight, everybody. And hopefully everybody's here. I would like to call on some of the people that came in early. So we have Joyce, we have also Joey, we have Mino, Aniterbio, we also have Iano Nimis. Okay, so guys, please share the Facebook Live if you can to your friends so that they will also benefit from this program. But anyway, for tonight, we have prepared great questions for you for Next Generation NCLEX. So I'll be explaining the question format and at the same time, the scoring for that as well. What's the scoring? And also other things about the concept review. You always have to remember that when you talk about Next Generation NCLEX, it's very important to know the question format, but at the same time, it's of course very important to know the concept or the content because you will not be able to answer the question correctly if you don't know the content anyway. Um, Before anything else, I would like to introduce myself. My name is Mr. Alan Matus. I'm a nurse educator for almost 25 years, I guess. I'm nurse educator and NCLEX specialist. I have been helping students pass their NCLEX licensure examination. Also, at this time, I'm a nursing faculty in a nursing college in Los Angeles, California. So I'm based in California, everybody. But of course, if you're coming from another part of the world or United States, then feel free to join our program. This is a program for everyone. I also published my book in Amazon. It's called Simple, Fast, and Easy NCLEX Review. And soon, hopefully, I'm revising the edition. So hopefully soon, the new edition will come out with the next generation NCLEX, of course. So I'm working on that right now. So kind of like busy. But anyway, I would like to welcome Mommy Lord's JG. So she said, "Go, good evening, Sir Alan, and to all." So I'm giving you a shout out. Okay, you have your picture there, and then of course we have Joe. Joe, hi. Okay, and then, of course, feel free to share this Facebook Live, everybody. Okay. All right. So before anything else, also, I would like to show you some of the important stuff that we have to announce first. So our 10-day live comprehensive NCLEX review webinar will start on July 15th to September 16th. It's going to be like 2 weeks from now, July 15th to September 16th. So we just finished our batch last week. So Now we have another batch coming in. So this is a blended learning course that combines live lectures and online assignments to master your nursing core content. Of course, we discussed next generation NCLEX questions, but the focus of the NCLEX review is really knowing your content, because in the NCLEX it's very important, guys, to know your content so that you can answer your NCLEX questions. Okay, so again, this one is going to be on July 15 to September 16, 2023. That will be every Saturday from 8 to 4:30 p.m. Pacific Standard Time. So you will have a different time zone if you're from the Middle East or if you're from the Philippines or another part of the world. So this is for US and foreign graduates, everyone. Another one we have, this is your chance to win. So for tonight, the more participation that you have, or the more viewers that we have, then we will pick the winner for a free 90-day online access and NCLEX review. So you'll be able to have access to all of my lectures that are recorded in the self-study program. So after this, we'll be drawing the winner and then announcing next week who wins the 90-day online access and NCLEX review. And of course, I would like to request everybody to share or subscribe to a YouTube channel. Share this with your friends so that they will also benefit from the program as well. Thank you, guys. So click that like button. Before we start our next generation NCLEX review for tonight, we always just have to discuss a little bit about the what the next generation test design is, or the next gen NCLEX test design. So we have 85 minimum questions with 150 maximum questions. The computer will stop anytime after 85. You have 50 non-scored questions, maximum of 5 hours. And then also you will have three NGN case studies with 6 questions each. So meaning that for the total of the examination after you're done, you will have 18 questions total from the case studies. And then the exam is still mostly composed of classic question format. So a lot of students have been so scared about the next generation NCLEX. But guys, remember, the exam is still mostly composed of previous NCLEX questions, the format. So you only have 18 questions the most for the case studies, and also maybe one or two for the standalone questions. But 18 would be the guaranteed questions that you will have from the case studies. Yeah, the good news also with the next generation NCLEX is that you're going to receive partial credit points for some question types. So meaning that before, with the select all that apply questions, everything, when you answer one wrong, then everything is wrong. But now you have partial credit points for some question types, so meaning that you're getting credit actually for the correct answer for multiple choice questions, okay, or questions with multiple answers. And of course, receiving those 6 questions from the case studies. These are the areas or skills that you will be tested on with the next generation questions. So the areas, of course, this kind of like follows like your nursing process. After you read the case study, the first question will be something about recognizing your cues if there's really something wrong with your patient. So that will be recognizing cues. The next one will be analyzing your cues, trying to find out what's really going on with your patient. The third one is going to be prioritize hypothesis. So what's going to happen to your patient? What's the risk? What's the complication? And then of course, generate solution means that you start thinking what will be the potential interventions for your patient? What do you think will the physician order? And then you have take actions, which is basically really doing the nursing interventions. And lastly, we are nurses, so we constantly evaluate if our actions are effective or not. So you will encounter questions that will be asking you if the patient's symptoms are improving or worsening. So you call that evaluating outcomes. So these cognitive levels from the NCSP and clinical judgment measurement model will help you kind of like definitely anticipate what kind of questions you're going to receive for the case studies, which is going to be 6 questions. All of these are the areas that you'll be tested on. And of course, you have the standalone questions. These are the different types or item types that you have. Um, I will try to introduce to you or to tell you what kind of question you're answering. But so far, these are the item types. A lot of them are very common, like select all that apply, select and multiple response grouping. Matrix means that you have a table, the drag and drop, close rational, the drop down, the highlighting, and the bow tie. Of course, the most important, the best way to really become familiar with these item types is to answer questions. Answer practice questions or QBank that you can use to get used to the testing format. So basically, your NCLEX review is still going to be the same. You will still be required to know the content. So your next generation question is just really basically knowing how to answer the question with the new format, getting used to it. But then at the end of the day, if you're guided by your content, you can still pass your next generation NCLEX. And to be honest with you, we have a lot of students who came back and said that they actually like the next generation question because it's like real world nursing. So which is good. So you also have your scoring models or your scoring rules. So remember that you have three scoring rules for your next generation NCLEX. You have the 0-1 scoring, which is basically earning a point for your correct answer. The one that you have to be careful with is the +1 or the plus minus scoring, which is basically correct minus wrong. So be very careful with those questions. And then lastly, you have the rational scoring, wherein you have a paired information and you have to get both correct. So in our next generation practice here or review, I will be telling you the item type and also the scoring model that will be used for that kind of question so that you're more familiar with the scoring. Okay. All right. Welcome, Camille Ann Pangilinan and Galina Niketinko. Very nice to see you here, guys. Okay, it's been a while. So the question that I have now, everyone, is: are you ready for our next generation NCLEX, everyone? Are you ready? Can you please say yes in the chat box? You're ready. Okay. All right, so let's have the first question, everyone. The screen is going to be small a little bit because you have a case study. So whenever we have a Facebook Live, I would encourage that you open your laptop instead or your iPad so you could see the question better. All right? Okay, so first question. Our situation for tonight is going to be focused on COPD. Everybody, can you still remember COPD? I'll be explaining a little bit about COPD for tonight. So let's have the first question, everyone. Okay. All right. So I'm gonna read the question, the next gen NCLEX question. So number one, um, you can grab a pen or paper to write the information if you want, you know. But again, if you're using a cell phone, this could be very small. So I would encourage you to use a laptop next time. So the nurse in the medical surgical unit is caring for a 60-year-old client who has been admitted from the emergency department due to exacerbation of respiratory symptoms. Nurses notes 700. Received client on bed with shortness of breath, alert and able to verbalize needs. Has history of chronic obstructive pulmonary disease for 15 years secondary to excessive smoking. Smokes 5 packs of cigarettes daily. Wheezing audible during expiration. Appears anxious, thin, and has barrel chest. No cyanosis noted. The client stated, my shortness of breath has been getting worse that I cannot even walk to the bathroom easily. The client is prescribed with amoxicillin 500 milligrams PO every 8 hours for acute pneumonia. Vital signs, temperature 98.6 or 37 degrees Fahrenheit. Blood pressure 140 over 80. Pulse is 110. RR 22. Pulse oximetry reading of 92% on 2 liters per minute oxygen via nasal cannula. No complaints of pain at this time. Wow, that was a long situation. Now, the question is, which of the following assessment findings require follow-up? Select all that apply. Number one, blood pressure. Two, temperature. Three, pulse rate. Four, respiratory rate. Five, pulse oximetry reading. Six, breath sounds. Or seven, skin color. Okay. I will repeat the question. You can read the case study because it's too long. I'll give you time a little bit. But your question is, which of the following assessment findings require follow-up? Select all that apply. I'm really going to give you a lot of time for this. So don't worry, everyone. Blood pressure, temperature, pulse rate, respiratory, pulse oximetry reading, your breath sounds, and your skin color. Now, you can also put which state or country are you joining from. I would like to find out if you're international or within the US. Or maybe you're just in my backyard right now, like you're my neighbor actually, and you're joining here. So put your location, everyone. So keep on reading the situation. I'm going to give you a few minutes to read the situation and put your answer on the comment section, everyone. Okay. So I would like to welcome Josine Andres Capuyon. Hi, Josine. Wilson Kata, Garcia Leanne, Chinriki Ogochukwu, Jandy Chavez, she's from the Philippines. Vancouver is Josine. Hi, Josine, you're from Vancouver, Canada. Okay. Pakistan, Irfanaz, hello from Pakistan. Okay, we have other people where, so we have an answer ready from Mino Jacob. Okay, then we have Jandy Chavez. Dennis Tuazan is from Wyoming. So when you read this question, everyone, I would like you to go back to the case situation and look at all the items. So find out which one is abnormal, like your blood pressure, your temperature, your pulse rate, for example, your respiratory rate, pulse ox, your breath sounds, and also your skin color. So try to go back to the case situation. Okay, case situation, and then find out which one needs follow up. Okay, which one needs follow up, everyone? Okay. Which one needs follow up? Okay. All right. So some people are already answering. So meaning that they have read the situation already. Go back to which one require follow up. Which one requires follow up? Something that would worry you, and it's something that you need to go back and ask the physician. Okay. And I will give you the answer in a moment. Okay, so keep on answering, putting your answers. Okay. So put your answer, everyone. All right. So I would like to consider your answers, everyone. Do you think the pulse oximetry reading is something that you will include as something that would require follow up? Because this is a patient with COPD for 15 years, and the pulse oximetry reading is 92%. So do you think is that something that's abnormal? The pulse ox for those with if you don't have any COPD, the normal pulse ox is 95 to 100%. But you have to think, if you don't have any COPD, or if you have COPD, do you think you need to report 92%? Is that something abnormal? Okay. Is it something abnormal if your pulse oximetry reading is 92% for something that has COPD? 92%. Do you really want it to be 95%? Okay. So you can still change your answer, everyone. You can. All right. And then also for the blood pressure is 140 over 80. What's the normal blood pressure, everyone? What is the normal blood pressure? So are you going to include that one too? Because it's 140 over 80 for the blood pressure. And for the temperature, is that normal? So that's the question that I have for you guys, the temperature. And what is the normal respiratory rate? Your respiration. Okay, especially for the adults. So I will give you 2 seconds to finalize your answer, everybody, after you analyze the situation. Okay, keep on analyzing, and let's see who will get the correct answer. Okay, for adults, especially your respiratory rate is very important. Okay, so do you think 22 is acceptable for an adult person? Okay. All right, so let's proceed. I'm going to give you the answer now. Okay, let's see, and then I will explain, okay, what's going to be the answer. So, but before that, the technique, as usual, for this situation is always to look at the case study, and then you have to go through one by one. And everybody, this is a select all that apply question. Whenever you have a select all that apply question, the scoring for this would be correct minus wrong. So you really have to be very careful when you answer this kind of question. So after I give you the answer, I would like you to count how many you got right minus wrong. Okay, let's see who gets perfect. All right, so the answer, everyone, is going to be, all right, so we have blood pressure, pulse rate, respiratory, and breath sound. Now, the key answer doesn't have blood pressure, but we have to include blood pressure. Okay, blood pressure is included because the blood pressure is 140 over 80. So the answer is going to be 1, 3, 4, 6 only. The answer is 1, 3, 4, 1, 3, 4, 6 only. The reason why we do not include your pulse oximetry is because for someone with COPD, we maintain a low level of oxygenation, and most doctors would prefer to have something that is 88 to 92% only. 88 to 92%, so that would be acceptable. So 92% is acceptable for someone with COPD, unless the doctor sometimes would specify, there's a standing order, what kind of a pulse oximetry reading he wants. So sometimes they want 90, sometimes they want 92, sometimes they want 88. So just really follow what's the order of the physician in terms of the pulse oximetry reading. Now, again, I would like to remind you the answer key for this is blood pressure, pulse rate. Pulse rate is included because it's 110, your respiration is 22, and your breath sounds, of course, because you have wheezing audible during expiration. Now, this is what you call a this is what you call a question, item type, extended multiple response, select all that apply. So select all that apply, meaning that you're able to click all the answers if you want, but the danger is if you're clicking everything, then you will get what? You will get probably zero because it's correct minus wrong. Can you please put on the comment section how many answers you got, everybody? What's your score? The score for this is going to be 4. 4 is going to be the total score. So did you get 4, everyone? Perfect. 1, 2, 4, 6. Nikki, Joe, Joy, Ennis, congratulations. You got it right. And Erica too. You got it right too. Complete. Perfect. All right. Okay. So that's it, guys. Now that's for your now you're being tested here for the in the clinical judgment measurement model. This is your recognizing cues, the first step, recognizing cues. We always emphasize, to all nurses that a very important part of our job is to be able to recognize change in condition. And change in condition usually means that when you're reading charts or when you're reading documentation, you're able to pinpoint immediately if there's something wrong with your patient and what are those symptoms that needs to be reported because they are abnormal. Okay. Now, once you have these cues and these are abnormal, then the question is, you start thinking, what's going on with your patient? Okay, so let's go to the next question, everyone. Okay, congratulations for those who got four. Mamilor's JG got four, so she's got perfect. Very good, and that's a very cute graduation photo. Okay, are they gonna be nurses too soon? All right, so next we have the same question. At this point in time, we don't really have change in documentation. It's still the same situation, but on the other side now you have this is a matrix question. Okay, matrix extended multiple response matrix. So the same situation, but the question now is this is analyzing cues. Analyzing cues. You're trying to find out what's going on with your patient, but usually in the NCLEX, they will give you this matrix, and then you have to identify the symptoms. Like you have the client findings, and then you have to identify what condition probably is that associated with. Now, all of these conditions are being mentioned, but it doesn't mean that they're happening to your patient. It's basically just trying to find out what do you think is really happening to your patient based on the symptoms. So the question is, for each client finding below, click to specify if the finding is consistent with chronic bronchitis, emphysema, or asthma. Each finding may support more than one disease process. Okay, so you have and just remember, everybody, that these questions are not from somewhere else. These are original questions from Matus Nursing Review. Okay? These questions, guys, are original from us. Now, the client findings are cyanosis, you have chronic bronchitis, emphysema, and then you have asthma. You can one by one put your answer in the chat box if you want, or you can put your answers all together. You can type cyanosis, barrel chest, if you want to type them. Okay, so cyanosis, where can you find that? You have to mark the barrel chest, the wheezing, the thin appearance, the cough with purulent sputum, and severe chest tightness. Now, again, this is a question that will allow you to click everything if you want. So this is correct minus wrong. This is correct minus wrong. Okay? Correct minus wrong. This is correct minus wrong, but then you can, the more that you have correct answers, then you can get points. So let's see if you can get points. Now, may I advise you guys, if it's a correct minus wrong question, just don't check everything because you'll end up being zero. Just check the ones that you really know in the situation. Okay? Don't check everything just because you think that, okay, I'm going to get points. No, because it's correct minus wrong. So be very careful. So I want you to go back to your content and then try to really think about the differences of the symptoms of these three. So you have chronic bronchitis, emphysema, and then you also have asthma. So you can type all your answers and giving you all the time in the world, okay, to click, put your answer. All right. So what are the differential diagnoses for or the symptoms for these conditions? Where can you see barrel chest? Where can you see wheezing? Okay. Okay, so Wilson has some answer already too. Okay. So basically he's typing chronic bronchitis and then putting all the symptoms. Okay. And then emphysema and then asthma. So that's a good way to put your answer too. Or you can type cyanosis and then you put under what condition is that. I'll give you more time, everyone, okay? I'll give you more time, so don't worry. All right, put your answers. Okay, others are still answering, so I still have. I'm gonna wait for the others to put their answer before I could announce the correct answer, guys. Okay, so let's say if you have all the answers, everyone, you're putting the answer. Okay, I gave you enough time. Okay. All right, so we have new messages. So Sheena already put her answer too. The others probably are still processing too. Okay. Say yes if you're ready for me to give the answer. Say yes, everyone, if you're ready for me to give the answer. Okay. Or else I'm gonna wait for everyone to finish. It's kind of like a challenging question. You have to pick the right answer slowly. Okay, so I'm going to give you the answer, everyone. Are you ready? Okay. All right. So when you read this question, number one, you need to know the differences between your chronic bronchitis and your emphysema. Now, all of this, your chronic bronchitis and emphysema and asthma are respiratory conditions. Now, your chronic bronchitis and your emphysema are the certified COPD conditions. Asthma is not a COPD because it's reversible. But chronic bronchitis and emphysema are the most common COPD conditions. Now you need to know the differences between your COPD, chronic bronchitis, and emphysema. Although your emphysema and chronic bronchitis will share general symptoms of COPD, of course, they will share general symptoms, but then there are some differences also. Asthma, I'm gonna give you also the answer for asthma. What will be the symptoms of that? Now, when I give out the answers, all to I would like you all to count your number of answers, everyone. Okay? All right, ready? One, two, three, go. So those are your answers, everybody. So your cyanosis could be found in chronic bronchitis and your asthma, not in your emphysema. When you go back to your book, everyone, cyanosis is chronic bronchitis. Chronic bronchitis, we call the patient blue bloater because they are cyanotic and they're usually obese. For asthma, of course, you're going to have cyanosis too. For emphysema, you always have to remember there's no cyanosis. For emphysema, we call them pink puffers. Okay, they're not cyanotic, but they are pink puffers. Their skin color doesn't change. So, chronic bronchitis is cyanosis, and then your asthma, especially asthma, of course, in severe conditions, you're going to have cyanosis. For your barrel chest, generally, these three can lead to barrel chest, although your emphysema is really the condition that leads to barrel chest, because of COPD. And then, of course, your asthma, in the long run, your asthma can also lead to barrel chest because of air trapping. And then chronic bronchitis as well, because these are COPD conditions. Your wheezing, that would be found in the three as well, although wheezing will be very pronounced in asthma. But in a way, chronic bronchitis and emphysema could also have wheezing. Maybe not that really very common, but generally when you have a COPD, wheezing could be present, especially asthma as well. For your thin appearance, that would be for emphysema. Emphysema patients are pink puffers and also they have a thin appearance. Okay. Cough with purulent sputum because of the inflammation. Purulent sputum would be more of chronic bronchitis, especially chronic cough with purulent sputum. Now, emphysema, there's also cough, but not that really severe. The same thing with your asthma. Asthma can also have cough, but cough with pus, especially a purulent sputum, that would be a chronic bronchitis. Your severe chest tightness, that is really very much common in severe asthmatic attack. So you have your chest tightness. It can happen too with COPD, but only when you really have exacerbation of symptoms. But asthma is really the condition we're in. You have your chest tightness, everyone. So how many points did you get, everyone, for the symptoms? The total number of points that you can get from this one is going to be 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 points. Did you get 11? Can you put your total in the comment section? How many is your total, everyone? So this is equivalent to 11 points. But then again, if you mark something that is wrong, then that would be deducted from your score because this is an extended multiple response question, matrix style. You're allowed to kind of like check everything if you want. However, this is correct minus wrong. Now, this one is analyzing cues. Okay, analyzing cues. So calculate your score. Let me see what you have, guys. Okay, let me see. What do you have? Who got 11 out of this one? Okay. Well, if you got 9 or 10, that would be a good score. 8, for example, that would be fine. Partial scoring. Okay. All right. So can I close this slide now, everybody? Okay. Again, let me just show you the final answers. Okay. I think for some of you, you know your scores, everyone. Okay. All right, so let's go to, before the next one, I'm going to have an announcement. Okay, my announcement will be, oh, so we have another question. Sorry. Okay, so another question. This is a third one. Complete the following sentence by choosing from the list of options. So this is prioritizing hypothesis. The client is at highest risk for developing embolism, hypoxia, or pulmonary edema. Put your answer, guys. This is prioritizing hypothesis. So based on the situation, what will be the problem of your patient? What's your answer, everyone? Based on the situation, what's your answer? So you really have to read the case situation very well. What will be the problem of this patient? You look at all the signs and symptoms. Remember your first answer earlier? You know, all those symptoms that you saw. So all the symptoms that you have. So going back to this one, what do you think is the problem of your patient? You know, this can lead to what problem? Seeing, when you answer questions like this, guys, I really want you to visualize. I want you to imagine your patient in front of you. Imagine your patient in front of you. You know, having all of the symptoms, what do you think is your priority? What is the priority? You don't imagine something else. Go to your case study. Go to your situation right now. What's going on with your patient? What is the risk? Go to your situation. What is the risk? Something that is not happening, but it's going to happen. Okay? Based on the symptoms that you can see. Is it embolism? Is there any indication that embolism will happen here? You know what embolism? Everyone, embolism is a clot, right? Clotting. So is there a clotting problem here in this situation? Pulmonary edema. Is there a heart failure going on in this patient? Do you see heart failure in this patient? Is there fluid accumulation? Okay. Is there any crackles in the lungs? Okay. Or is it hypoxia? Is there anything wrong with this patient in terms of breathing, in terms of, the presenting manifestation of your patient? All right. So the client is at highest risk. So you enter the room of the patient and you see this. So what's the highest risk? Okay. All right. So the highest risk for this patient, everyone, is going to be hypoxia. Okay. Hypoxia. Why? Because number one, it says there, receive client on bed with shortness of breath. There's shortness of breath going on with your patient, although the oxygenation is okay. It's 92% oxygenation. But there's a risk of hypoxia because your patient is having shortness of breath. So probably your patient still needs more intervention because he's still having shortness of breath. Although your pulse ox is 92%, but that 92% pulse ox may not last long if your patient does not receive attention and your patient has wheezing audible during expiration. The patient the patient doesn't have any cyanosis, of course, not yet, but you look at the RR. The respiration of your patient is 22. The pulse rate is 110. So meaning that there's problem with oxygenation there, right? So in this question, guys, hypoxia is the answer, and not because it's airway, breathing, circulation. But then you go to your situation, you read the question, and you see what's going on, and then you kind of like visualize. Okay? It's also possible that these are all risks the patient can have, but what do you think comes first? Hypoxia comes first. Okay? If there's a lot of mucus secretions, and you can say airway clearance is going to be your problem. But if you have crackles in the lungs or rails, for example, then you can say pulmonary edema. Especially if there's a history of heart failure. But in this situation, there's no mention of mucus. There's no mention of pulmonary crackles, but then it's wheezing. So I hope you agree with the key answer, everyone. The answer is going to be hypoxia. Okay, so be careful. Go back to the situation again. All right, so before anything else, we will have our last question after this. Just an announcement. July 4th is coming up, everybody. Do you have any plans? Where are you going? Are you going to Vegas or what? Some fireworks. So Independence Day sale, that will be July 1 to 5, 2023, 50% off. Our online self-study, which is $499, will only become $2,499, 249.50. The self-study comprehensive online NCLEX review course, 1 year unlimited online access NCLEX review. So normally $499 is only $249. And you do have the coupon code at the checkout. So RN 50% off for RN review and PN 50% off for PN review. So please share to your friends who wants to avail of this promo, because once in a while we have this. We slash off the prices for the self-study comprehensive review And then you can get a workbook together with this as well. Okay? All right, so that will be July 1 to July 5, 2023. Okay, everyone, are you ready for our last question for tonight? Okay, so we have last question. Let's see. Can you say yes in the chat box? Okay. So our last question, everybody. Let's proceed. All right. So the same situation, but then you have the interventions on the side. The nurse has reviewed the nurse's notes from 0700. For each potential nursing intervention, click to specify whether the nurse's notes intervention is indicated or not indicated for for the care of this client. So you have potential nursing interventions here, and then indicated or non-indicated. Now this is what you call the testing you for generating solutions. So what do you think will be a potential intervention? Indicated. Let's see. Place client in orthopneic position. Number two, increase the oxygen flow rate to 6 liters per minute by a nasal cannula. Next is provide fluids as indicated or tolerated rather. Request an order to administer an intravenous fluid bolus. And lastly, you have suction the airway. All right, so again, these are your potential nursing intervention. Place the client in orthopneic position. Increase the oxygen flow rate to 6 liters per minute by a nasal cannula. Provide fluids as tolerated. Request an order to administer an intravenous fluid bolus. And then lastly, you have suction the airway. So what do you think is the answer? Okay, all right. For each potential nursing intervention, so I'll give you time a little bit, then you can put your answer. Okay? So we have 4 NGN questions for tonight, no? 4 questions. Wow. And you can also put your rationale in when you answer your question. That would help your classmate know why you put a certain answer. So Michael Vincent Tomambling already has his answer. Michael, you have to double check your answer. One is wrong in your answer, Michael. One of them is wrong. Okay, so let's see. What about the others? Are you putting your answer? Annie Turbio has her answer already. Okay. So I have a question to you, everyone. What is orthopneic position first? What is that orthopneic position? You kind of like need to know that. And then the question is it appropriate to give 6 liters of oxygen to someone with COPD? Okay. Is there a need to suction the airway? Or do we need a bolus of IV fluid to this patient? Okay. So let's get the answer. Let's see. Some of you are still answering. Okay, last 20 seconds. Then I'll put the answers. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's have the answer, everyone. Okay. So when you answer this question, you have to go back to your content again. Content, like let's say, what is orthopneic position? Orthopneic position is when you place the patient sitting upright and kind of like leaning, you put a table. Okay. So let's have the answer, everybody. All right, so that's the answer, everyone. So orthopneic position is when you place a client with COPD sitting upright and then leaning forward because it provides them more space for breathing. So when the client is in the orthopneic position, it elevates the clavicle and allows a more space for chest expansion. So that's why it's indicated your number one. Number two, we never increase the oxygen of your patient with COPD to 6 liters per minute. Okay, your COPD patient should only receive at least two. Okay, 1 to 2 liters, or sometimes in other books they mention 2 to 3 liters, but generally six. That's really very high. We do not give patients with COPD with that one. Provide fluids as tolerated, of course, unless the patient is not alert or drowsy. Then you don't provide something by mouth if your patient is not alert. But this patient is alert and responsive. So you could provide fluids as tolerated, and that's fine. As tolerated, especially with COPD. Uh, Request an order for intravenous fluid bolus. No, we don't really need a bolus IV at this time. It doesn't say there that your patient is dehydrated. No, there is nothing. And then suction the airway. There's no need to suction. There's no mucus secretions in the situation. So it's not indicated. No need to suction the airway. So it can, again, go back to the situation, everyone. Okay. So, guys, again, let me show you the answer. Okay. So that's the answer, everyone. Okay. That's the answer. Look at the final answer, everybody. Okay. And feel free to go back. This is going to be on our Facebook page and then also in YouTube. And before we end tonight, okay, of course, I would like to thank everybody for being here, and please share with your friends, okay? And maybe next week, if I'm not busy, there's going to be another Facebook Live. But again, thank you very much, everyone, for being here. And of course, other students will be watching this as well. So good night, everyone, and have a safe 4th of July. So thank you very much, guys. Kat, Michael, Joe, Nikki, and to the rest of the people who joined our Facebook Live for tonight. So thank you, everyone, and God bless.